Hello everyone, I am Dr. Rajesh Chokhani, a general pediatrician from Bandra, Mumbai, and today I will be talking on changing trends, a challenge to the already trained. We all have been witness to many changing trends in the field of medicine as a whole. After all, change is the only thing that's constant in life. For those of us who have been trained in the past, understanding, accepting and implementing these changes in our practice can be quite a challenge. In fact, even for those who have been trained now in the current era and therefore for whom these trends are not new, there can be challenges, albeit of a different kind. In the next few minutes, let's deliberate on how these changing trends are a challenge to the already trained. There have been rapid advances in the field of diagnostics and therapeutics. Molecular biology has arrived with a bang, and theoretically it is now possible to prove more and more infections by proving the presence of the microorganisms. Every day, newer and newer diseases are being linked to newer and newer defective genes. There are a host of monoclonal antibodies now available to treat autoimmune conditions. Those of us who were trained prior to all this, the challenge for them is to remain updated with all these new developments, to find the right unbiased source to get updated from, to sift the useful from the unnecessary clutter, to learn how to correctly apply these advances in practice, and last but not the least, to find time to get updated. We all have to regularly earmark some time in our daily routines to remain updated. Incidentally, teaching is a very effective method of remaining updated. Some of us are resistant to change, or at least find it difficult to change. We may remain stubborn and refuse to accept the need to change. We may continue to depend on our biased personal experiences. We know that experience has also been defined as the ability to repeat the same mistakes with increasing accuracy and confidence. So it is no surprise that another new trend is that of evidence-based medicine, which tries to do away with all these biased experiences. But on the other hand, some others amongst us have gathered a different kind of quality experience arising out of well thought out actions after taking many important variables into consideration. Such quality experience is highly valued. So the challenge for those trained in the past is to strike the right balance, to keep an open mind and unlearn and relearn things that have unequivocally changed thanks to evidence, and yet continue to use this high quality experience in other areas. Those who have been trained now face a different kind of a challenge. They may not have had adequate exposure to clinical methods. In fact, they may have had limited exposure even to patients. So they may not have developed the confidence to use the science of probability and diagnose common things clinically. FOMO, or the fear of missing out, pushes them to use more and more investigations to rule in or rule out. And when the results are inconclusive or conflicting, they find themselves at sea. So, in other words, they lack the clinical experience and heavily depend on generating evidence through investigations. The challenge for them is to acquire the art of logical thinking, which will show the way forward even when investigations fail. These trends which we just discussed have contributed to another trend partly, and that is the boom of super specialists. Considering the information explosion and the wider array of diseases that we now diagnose, the presence of super specialists is definitely a boon. Because after all, being restricted to a particular field or speciality, they have much more knowledge than others. The challenge for them is to retain a strong, wide, general base so that with minimal or no investigations, they should be able to identify patients whose complaints do not lie in their domain. And for those patients who do belong to their specialty, they should learn the art of drawing a line somewhere so that they do not investigate unnecessarily, searching for uncommon diagnosis in every patient. The general physicians who were trained in the past used to diagnose many conditions like Guillain-Barré syndrome or ITP or IBD themselves. It is possible that they picked up the classical presentations but missed the variations. Those who are trained now routinely refer every other patient to the respective specialty, with the result that they have often been reduced to traffic policemen merely directing the traffic. The challenge for both the groups is to correctly choose the patient that needs referral. There is no doubt that the super specialists will be able to help many patients much more, but if all general physicians follow the trend of outsourcing their diagnostic process to super specialists, it will undermine their own confidence in the long run, besides adding avoidable costs to healthcare. So, it is only a judicious use of super specialists that will prevent the boon of having them from becoming a bane. Patient expectations are changing. In the earlier days, the doctor's words were the gospel truth. Patients believed, obeyed, and waited patiently both to see the doctor and to get results of treatment. Today, patients are more informed, more questioning, more demanding. They expect instant service, quick fix treatment, and guaranteed results. They think they may be well informed, but actually they may be ill informed thanks to the internet. The challenge for those already trained is to acquire the ability to satisfy these doubters and critics, to prevent compromising practice and principles while trying to cater to their demands, and to prevent ourselves from practicing defensive medicine all the time in response to patient offensive. The epidemiology of diseases is also changing. Conventional infections are behaving differently, and it is not uncommon for routine viral infections to now last longer, thereby testing everyone's patience, and recur more frequently. The challenge is to maintain rationality and resist the temptation to use antibiotics. On another note, even the most conservative physicians have to now order a gene expert for every suspected patient of tuberculosis because resistance has become so common. On a third note, the epidemic of lifestyle diseases is affecting all ages. Since reversing an established lifestyle disease is tough, the focus has to be on incorporating advice on prevention, which is time consuming. Those trained in the past always used to spend time with their patients, but now the trend is to spend less and less time with patients because medical practice has become a rat race. We compete with each other for number of patients seen, number of rare conditions diagnosed, etc. So the challenge is to prevent the erosion of good old values in the face of changing trends. Therefore, to sum up, the challenge for those already trained is to master the balancing act, to balance quantity with quality, experience with evidence, clinical methods with investigations, conservatism with aggression, containing the cost of healthcare with compromise of healthcare, and so on and so forth. This balance can only be achieved if one thinks before taking each step, adapts intelligently to the changes, and thereby evolves effectively with the times. It is only this that will help us achieve a judicious mix of the old and the new, and thereby rise up to the challenge posed by changing trends. Thank you. The next video will be by Dr. Amdekar sir on counseling and communication a must.